A warm welcome to today's talk. It's Wednesday the 9th of March. Now, I've been asked for a long time to look into these Pfizer documents and the Food and Drug Administration documents released as a result of the Freedom of Information request. And it's taken a while to work out what's going on here, but I'm not saying I'm there yet, but I'm going to show you what I've got. And it looks like in the first 3 months there was 42,000 adverse events reported after the marketing of the Pfizer vaccine, and 1,223 deaths. Now, this is just quite alarming, really. So let's look at this now. Now, this starts off, as far as I can tell here, Public Health and Medical Professionals for Transparency. And this is a group that seem to be wanting just that. They want transparency, and there's a large list of prestigious, highly qualified signatories on that group. Now, what seems to have happened is they've put in this information or Freedom of Information Act request using the solicitors. And these documents are now in the public domain. They're all on this website here. So I've put the link in so you can see all of these for yourself, and a lot of these have just been released as a result of this Freedom of Information request itself. So that was the request. I'm not quite sure what that is. I think that's an application to the court, but what is fairly clear is this: the United States District Court for the Northern District of Texas. And this is the plaintiff, which I believe is the Public Health and Medicines Public Health and Medical Professionals for Transparency group against the Food and Drug Administration. And the judge here has ordered the Food and Drug Administration rolling productions of each due to the first business day of each month instead of every 30 days. Okay, that's administrative things. But the point is there, the FDA will produce 10,000 pages from the first two productions. The FDA will produce 80,000 pages on or before the 2nd of May, 1st of June and 1st of July. So it's ordering a huge amount of data release. Now, the immediate question in my mind is why wasn't this data in the public domain already? Surely we want to know this information to make informed healthcare decisions. Anyway, this group, this group here, if you click on their website, go into their website, and you can click on Pfizer's documents there. That takes you through to this, and the one I'm looking at here today is this one here, post-marketing experience, and these are now all fully downloadable, courtesy of this site. They can all now be downloaded, which is great. And this is the one we want to look at particularly. So that's kind of the convoluted story so far. Why has it been so difficult to get this information? Court orders. We're talking about a health issue here. Surely this should have been public domain information from the start, so that we could have been well informed. But let's look at it anyway. So that's the group there. That's their link. Freedom of Information, all those things I've just shown you are all there, and that's the court order. So you can actually download these for yourself, and that's the list of downloadable documents, which, as we've said, is extensive. So what we're looking at here is this one. This is where most of this information is coming from, and this was originally confidential to Pfizer before it had been released, and it's quite an extensive document, and I must say it's not a particularly easy read. It's quite difficult to make sense of what. There's a lot of abbreviations and things. They do give you a list of abbreviations that helps. Anyway, cumulative analysis of post-authorization adverse events reporting. So this is putting together the analysis of the post-authorization. This is post-marketing after the emergency use authorization of the Pfizer vaccine. As I say, check on it for yourself. So this is adverse events reporting, and it's only a very early stage. It's only from the 1st of December 2020, and of course the Pfizer wasn't approved. I don't think it was in the States till the 11th of December, through to the 28th of February. So it's 3 months at most. So through to the 28th of February, a total of 42,086 cases reported. Some medically confirmed, others non-medically confirmed, but that's the data set they seem to be working off. 42,086 adverse events. It would have been good to know about this at the time, wouldn't it? Containing 158,000 different events, so obviously some people having more than one event. Most cases were received from the United States, 13,739, but also from the United Kingdom, also from Italy, also from Germany, also from France, also from Portugal, also from Spain, and from 53 other countries as well. So quite an impressive piece of post-marketing data gathering, really. So obviously we want to take these, what we should do now really is take these numbers, the 1,223 associated fatalities and the 42,000 and a few associated adverse events, and relate that to the number of vaccines given. But this is the part that deals with the vaccines given, and it seems to me that this is redacted. Now, if that is redacted, why on earth would they want to redact that information? Because that means we could work out the percentages of people getting adverse reactions and the percentage of people dying due to vaccination, but we can't because we don't actually know how many vaccines were given out. Why would they want to redact that information? Why wouldn't we be able to access those percentages? Unless I'm wrong and that means something else, but I think it means redacted. Do let me know. Since the 11th of December 2020, Pfizer-BioNTech vaccine has been available under emergency use authorization in the United States, which we're looking at as today's example. Now, the final approval wasn't given until the 21st of August. And at that point, Janet Woodcock, Dr. Janet Woodcock, acting FDA commissioner, said this, and this is on that site there. Check it out. This is as reference based as I can make it. While millions of people have already safely received COVID-19 vaccine, we recognise that for some time the FDA approval of a vaccine may now install additional confidence to get vaccinated. So, in other words, this is the move from emergency use approval to formal approval. Now, she's saying safely here. But at this time, my understanding is she would have had access to this document. So how would you say it's safe when this document is indicating there's been 1,223 associated deaths? That's that bit there with the redacted bit in. You can download this. You can get your own PDF version of this, packed full of very useful information, but as I say, not that easy to access personally for me. It took quite a bit of effort to get into it. Today's milestone, this is talking on the 21st of August, put us one step closer to altering the course of this pandemic in the United States, according to Janet Woodcock. So 21st of August, and remember this data that we're looking at here, this data here it only goes through to the end of February, wasn't it? 28th of February. So, what did she have access to this data then? If so, how can she say it's safely? Let me know if you understand that, because it doesn't make too much sense to me. So, moving on from this statement here from Dr. Woodcock about the safety of the vaccines that have been received by millions of people, let's move on to the adverse events reported as of the 28th of February. So that's March, April, May, June, July, or basically 6 months before. And of course, the data in between times, I don't think that's been released yet. It's going to be released, as we saw, on this rolling basis. Anyway, so information that was presumably available. This is the information that was available to those who were allowed to see it at the end of February, we believe. That contains the greatest number. So these are greater than equal or greater than 2% of events. Where general disorders and administrative site conditions, they accumulated 51,000 adverse events there. I think that's adverse events. Nervous system disorders. So these vaccines that have been safely administered were associated with 25,957 nervous system disorders. These vaccines that have been safely administered, according to the FDA statement there, were associated with 17,283 musculoskeletal events. These vaccines that have been safely administered were associated with 14,096 gastrointestinal disorders. These vaccines that have been safely administered, I could go on, couldn't I? You can read the numbers there. Skin, 8,400. Respiratory, thoracic, mediastinal. The mediastinum is the bit in the middle there, between the lungs. 8,884. Infections and infestations, 4,610. Sometimes I read these numbers wrong. So if I read the numbers wrong, the number that's written down is the correct one. So I just have difficulty reading numbers sometimes while making videos. So it's the number that's written down is accurate. I do check those. Injury, poisoning, and procedural complications as well. That as well. Cardiovascular. This is adverse events of special interest. AESI's adverse events of special interest. Number of cases, because of course we talked to Kyle and Adam and people about adverse cardiac events or presumed or associated adverse cardiac events. Number of cases 1,403. 3.3% of the total post-marketing adverse events data set. Not 3.3% of people that had the vaccine, 3.3% of the adverse events dating set. And that is all available there. Obviously, you can't see it on your phone or your screen, but if you download it, all the information's there, all broken down really quite nicely about the adverse events of special interest that had been noted during the safe administration of this vaccine. I think you can tell I'm not a happy man. Summary. Just before, there we go. That's just the ones that are medically confirmed and not medically confirmed, right? Summary and conclusion. Now, this is the summary and conclusion of this report. So long report, lots of information there. I just want to check actually, because the summary and conclusion here on my notes says that review of the available data for this cumulative post-marketing experience confirms a favourable benefit risk balance for the Pfizer vaccine. That seems to be the conclusion of this report. I'm just struggling to see if it really says that. I know it does say that because I cut and pasted this. I mean, having said all this, is that their is that their conclusion? There we go. No, I got it right. There it is. You won't be able to see it very well, but that's what it says there. They conclude there's a good risk-benefit analysis. Now, in addition to this, it also covers additional events, adverse events of special interest, and here's the list here. Now again, you won't be able to see it, but this is I can't remember how many is listed here. It looks like hundreds. I think they do say somewhere, but all these are syndromes or conditions of special interest associated with the period of time after the vaccine. Now, to be fair, some of these probably only occurred once or twice. We don't know, but that is one heck of a long list of medical conditions. And again, I certainly wasn't aware of all these until I read this, and even then, I still don't know what a lot of them means. But the list is long, quite incredible, really. Why weren't we made aware of these at the time? Because if we were aware of them at the time, we could have had an index of suspicion for them and kept an eye out for them. Peter Marks, MD, PhD, Director of the FDA Centre for Biological Evaluation and Research, says this, and I think this is from that FDA site I showed you the reference for before. So this, if I'm right, this will be writing on the 21st of August, or published on the 21st of August, and as we say, this data set is 6 months before. Our scientific and medical experts conducted an incredibly thorough and thoughtful evaluation of this vaccine. We evaluated scientific data and information including in hundreds of thousands of pages. So it looks like they've looked through it all. Hundreds of thousands of pages. Conducted through our own analysis of the Pfizer vaccine safety and effectiveness. and perform detailed assessment of the manufacturing processes. Okay. He says this: the public is counting on a safe and effective vaccine, which it now transpires it wasn't as safe as we've been led to, as had been intimated. The public and medical community can be confident, can we? Confident that although we approved this vaccine expeditiously, it was fully in keeping with existing high standards for vaccines in the United States. So they are saying that the vaccines between the 11th of December, when it was first given emergency use authorization, and this report on the 21st of August from the FDA was saying that millions of doses have been safely administered. I'll let you decide whether the information that's now been released indicates safe administration, as we just look at some of those potential associated conditions. I'm just really quite bemused. And also, we had our politicians and medical leaders telling us that this vaccine's safe and effective all this time. But I can only assume, well, I simply don't know. This data was available to the FDA. Was this data available to the regulatory authorities in the UK, in Germany, in Canada, in Australia? I would assume so. Finally, has this changed the risk-benefit analysis of giving vaccines compared to the condition? Well, Austria, this is the relevant minister, senior politician in Austria. The law passed in January for mandatory vaccinations, in force since early February for a mandatory vaccination in Austria, which I remember we covered at the time. She now says it's not proportionate because the relatively mild symptoms experienced by most people who contract Omicron. So it looks like Pfizer and the FDA concluded that the risk-benefit analysis was favourable way back in the early part of 2021. We could argue about that, given that there seems to be 1,223 associated deaths from an unknown number of Pfizer vaccinations in the first 3 months. I would question that now. But now, with Omicron, because it's so much less... people are getting so much less sick, so much lower hospitalisation rates and lower death rates from Omicron. Not gone away, but much less. Surely that's complete. Well, that has, I think we can state as a fact, that has changed the risk-benefit analysis. So really, governments like Austria need to be reviewing the situation against the increased risks of vaccination. In this case, the Pfizer vaccination. We don't have the full details on the other one. We need to compare that now, risk that we are now learning about due to this freedom of information activity, and compare that to the known risk from Omicron. It's maybe time for the risk-benefit analysis has changed. Maybe that needs to change through into policy. But I must say, I just feel so... why on earth does it take the signature from a judge? Really, what is that about? So there you go. We've learned things here that we didn't know at the time. At the time, we were taking the word of these senior people. The other thing about this is why hasn't the mainstream media doesn't seem to have taken this up at all? I would have thought this is a complete scandal, perhaps on a par with Watergate or the Perfumo crisis or whatever scandal you have in your country. Doesn't seem to be taken up. Of course, everyone's to some extent rightly preoccupied with the war now, but there's still plenty of mental capacity in these countries to ask sensible questions, I would have thought. And the mainstream media just don't seem to be taking this up as far as I can see. So there we are. That's the situation as I've worked it out so far. I mean, you could argue, of course, there's a lot of people dying with coronavirus, of course. But there's been times in 40, I've been practicing for about 40 years, but there's well, a lot of that was teaching, but I've done a lot of clinical. I've been a clinical nurse for a long time, and was again recently. But there's times where you don't manage to save someone's life. Of course. And that's kind of acceptable in a sense, because men and women are mortal. Of course we are. Even children die sometimes. So that happens. But if it's something that I've caused, then that's a bit of a different thing. And there has been times where I've reflected on interventions that I have carried out and come to consider that perhaps accelerated someone's death. Now, I was probably doing that for the absolutely right reasons, I would hope. And there are times where it's acceptable. So sometimes we give terminal patients analgesia, painkillers, knowing that may well accelerate their death, and that can be acceptable for quality of life. But to actually do something that does harm to people that are otherwise healthy, you could argue it is a fundamental breach of the Hippocrates idea that first do no harm. And it appears we've done some harm. As far as we know, all of our current regulatory bodies are still saying the risk-benefit analysis is favourable, but in terms of we could argue about the past, we could argue about Delta, but in terms of Omicron, the risk-benefit analysis has changed, and let's hope that starts feeding through into policies. And I think maybe the other thing that this has done is it's just destroyed, in my view, it's just destroyed trust in authority. So you'll get senior people saying this is safe and effective, and it turns out that their understanding of the word safe and my understanding of the word safe are really quite different. So are we going to trust these people in future? It's a completely separate matter, and probably waffling on a bit now, but the reason that most governments didn't believe that the Russians were going to invade Ukraine was not because there was poor intelligence there. It was because Colin Powell and his mates had said Saddam Hussein, and Tony Blair and all these other people at the time said Saddam Hussein could be raining weapons of mass destruction down on us in 45 minutes due to fraudulent intelligence. So the trust had been lost. The trust had been lost as a pretext, as I see it, as a pretext for the Iraq invasion, and now, when there was genuine intelligence, people didn't believe it. So is the situation analogous here? Is there going to be something coming along in future where we really, really, really need to trust our healthcare leaders? And as a result of this, maybe some of us won't. So just float that idea. Okay, thank you for watching.